Hey everyone, welcome back to the channel. Today we are diving into an important topic. Do you know that your lifestyle can increase the risk of developing hernia or it can decrease also? So we will break down the key contributing factors, how they impact your body, and most importantly, what you can do to prevent a hernia. So if you want to protect your health, stick around till the end. But before we begin, please make sure to like, share and subscribe so that you never miss an important health update. So in a nutshell, what is a hernia? We already made detailed video on the hernia and their types. You can click on the button to watch that video. However, to give a comprehensive definitions, a hernia occurs when an internal organ or part of tissue pushes through a weak spot in the surrounding muscles or connective tissue. But what many people don't realize is that certain lifestyle choices or habits can significantly increase the risk of developing ones. So there are some lifestyle factors contributing to hernia in recent times. Now let's talk about the major lifestyle factors that can contribute to hernia formation. First, let us discuss about obesity and poor diet. Excess weight puts an extra pressure on the abdominal wall, thereby increasing the risk of hernias, especially around the belly button and the groin area. Individuals with excess weight are at higher risk of developing hernia, particularly inguinal and other part of the abdominal hernias, due to increased abdominal pressure. They also face higher recurrence rate of hernias and surgical complications when they are undergoing hernia repair. Eating more processed foods, low fiber diet, more intake of ready-to-eat meals can also lead to constipation, which will again put additional strain on the abdominal muscles, increasing the risk of hernia development. Now, second is heavy lifting with poor technique. Improper lifting, whether in gym or you are at work, of heavy objects can increase the pressure inside the abdomen, which can strain the abdominal wall muscles and tissues. Bending the waist instead of bending at the knees when lifting with a rounded back, rushing and using poor form during the lift, etc. can increase the strain. Again, repeated strain from the heavy lifting can lead to improper muscle engagement and increased strain on the abdominal wall. If a weakness already exists in the abdominal wall, the increased pressure can cause organs or part of tissue to bulge through that weak spot, resulting in a hernia. Even if you already have a hernia, heavy lifting can worsen the symptoms and potentially cause the hernia to become larger or rather more painful. Now next is chronic coughing or smoking. Long-term smokers are at higher risk because chronic cough increases again the intra-abdominal pressure. Smoking also weakens the connective tissue and making hernias more likely to develop. Chronic coughing, whether due to smoking, asthma, bronchitis or any other respiratory conditions, can create significant pressure within the abdomen. This repeated pressure can weaken the abdominal wall muscles over time, making them more susceptible to bulging or tearing. Now let's discuss persistent constipation or straining. When you strain during bowel movements due to chronic constipation, you put an unnecessary pressure on the abdominal wall. Persistent constipation or straining during bowel movements, especially when accompanied by a hernia, can indicate a serious issue like a strangulated hernia requiring immediate medical attention. A hernia can sometimes cause a bowel obstruction, making it difficult or impossible to pass stool, leading to constipation. A sedentary lifestyle and weak core muscles can increase the risk of hernia, as weak abdominal muscles provide less support to the abdominal wall, making it easier for the organs or tissues to push through. Lack of exercise leads to weak abdominal muscles. The tone of the abdominal muscle decreases, which makes it easier for hernias to form. Prolonged sitting and slouching can increase the pressure within the abdomen, which can strain the abdominal wall, especially if the muscles are weak. Pregnancy naturally stresses the abdominal wall, and repeated pregnancies increases the risk of developing hernias, especially umbilical or paraumbilical hernias. The growing uterus and fetus put a significant pressure on the abdominal wall, which can weaken the muscles and tissues, making them more prone to bulging or tearing. Previous pregnancies, especially those with long labors, can also contribute to weaken abdominal muscles and increase risk of hernias. By the way, most of our viewers are not yet subscribed. So if you are enjoying the content, hit the subscribe button and turn on the notifications. Now let us jump to how to prevent hernia. Can you prevent hernia? Definitely yes. Now that we know the risk factor, let's discuss one by one. So first one is to maintain a healthy weight. Excess weight increases pressure on the abdominal muscles, making them more vulnerable to hernias. To maintain a healthy weight, rather focus on a proper balanced diet rich in whole grains, lean proteins, healthy fats, and plenty of fruits and vegetables. Avoid processed foods and sugary drinks that contribute to weight gain. Regular physical activity, for example, such as walking, jogging, or strength training, can also help keep your weight in check and strengthen your abdominal muscles. While lifting, always use proper technique. Lifting heavy objects incorrectly can strain your abdominal muscles and it can lead to hernia formations. When lifting, always bend at your knees and keep your back straight. Avoid sudden jerky motions and if possible, get assistance with lifting extremely heavy items. Consider wearing a supportive belt if your job requires frequent heavy lifting. One of the most important factors is smoking. So, smoking weakens connective tissue and leads to chronic coughing, both of which contribute to hernias. If you smoke, quitting can significantly reduce your risk. Talk to your doctors about smoking cessation programs or medications that can help. Additionally, avoid secondhand smoke can also improve tissue health and overall well-being. Stay properly hydrated and eat fiber-rich food. A diet rich in fiber can prevent constipation, which reduces the need for straining during bowel movements. Aim for at least 25 to 30 grams of fiber per day from sources like whole grains, beans, vegetables, and fruits. Drinking plenty of water, at least 2 to 3 liters, approximately 8 to 12 cups a day, also keeps your digestive system functionally smooth and prevents unnecessary strain on your abdominal wall. You need to strengthen your core muscles. A strong core helps support the abdominal wall and reduces the likelihood of hernia. Exercise such as planks, leg raises, and controlled abdominal workouts can improve your core stability. However, avoid excessive or improper abdominal exercises that might put undue strain on weak muscles. Seek medical attention early if you notice any signs of hernia such as bulge, discomfort, pain in the abdomen or groin. Consult your surgeon as soon as possible. Early diagnosis and treatment play a very vital role in preventing complications, such as strangulated hernia, which is a medical emergency. Regular checkups can help detect hernias before they become severe. Hernias are really more common than you think, but by making a few smart lifestyle choices, you can significantly lower your risk. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content. And if you have any questions or personal experience with hernias, please feel free to drop them in the comments below. I would like to hear from you. Thank you. Take care of yourself.